be real, parenting is not easy, but you are not alone. Welcome to The Parent Prescription, a podcast where I will give you real, practical advice to help you navigate the ups and downs of raising healthy, happy children without losing your mind. This week's episode may seem a little redundant or just common sense, but I get asked these questions all the time. And so I want to share with you the difference between the visits at a pediatric office, or really any office, but I have to focus on pediatrics. And so if you hang tight, you can listen in to see the difference between each type of visit so that you're not confused when you call. There are differences not only with how you schedule it, but the way that it's billed. And so if you stay tuned, we're going to talk about the different office visits that we have in the pediatric practice so that it can help you when you call to schedule. Okay, let's start with the most common, the wellness visit. Okay, we have people that call and say, I can't get in. I've tried to get in. I can't get in to see you. And I'm like, well, why not? Why not? Our visits, usually you can get in the same day or the very next day. And they say, well, I need to get in because she's got a cough. And I was like, what did you say when you called? Well, I need a visit, or I need shots, or that is a wellness visit. So a wellness visit is your typical childhood scheduled visit. Newborn, 2 months, well, 2 weeks, 2, 4, 6 months, 9 months, 12 months. Like your 15 months, 18 months, 2 years old, 3, 4, and then once a year, right? These are just wellness check-ins. Are we growing well? Are we developing well? Do we have anything that we need to do, like any referrals for speech therapy, physical therapy? Are we developing and growing well? Is the blood pressure okay for our bigger kids? These are just typical wellness visits and give you preventative care information. So those are your wellness visits. It may take a little bit to get in for those because you're supposed to schedule those as you're walking out the door from one wellness visit to the next. It may take time because we don't fill the day up with wellness visits. We only have a select few slots for those visits because they take a little bit longer most of the time, okay? And then you have a typical sick visit. So let me explain. When we say a sick visit, that's anything that's not a wellness visit. So if you go, I just need an ADHD follow-up, I just need a med check. So we don't call that a well visit. Your child is well, but a wellness visit is our typical visits that we just went over to get shots, to get developmental screenings. That's the wellness visit. A sick visit includes anything that we're checking in with that's not well. So if you say ADHD, my kid is well, I need a wellness visit, and they give you a visit 2 months down the line, you're like, how am I going to get the medicine? Right? You go, no, you need a sick visit just because we're talking only about medicine. So a sick visit is anything that's not a normal, typical wellness scheduled visit. I want you to know the difference because people get frustrated if they can't get in for a rash or ADHD medicine or blood pressure or headaches, because they will say, well, my kid is well, but it is not considered a wellness visit. That is a sick visit, okay? Yes. Next, a weight check. Just a weight check for our little, especially our little ones, but our babies, when we're just checking a weight to make sure, say we had a 2-week wellness visit and they did not gain good weight, and I just want to do a weight check. That is not a visit. That is just a weight check. They're going to come in. They'll have you to strip down for the babies. For the older kids, they won't have you to strip down, but they'll have the babies to strip down. They'll do a weight. If the weight looks good, they'll let me give them a thumbs up or check off, and they'll let you go. That's a weight check. That is strictly a weight check. You come in, the nurses see you, they check your weight, make sure they get a thumbs up from me, and then they let you go. On those visits, that is just a weight check. So that's a different scheduled visit. And then we have shot only visits. So if your child is up to date on their wellness visits, but they need a shot that they were missing, or that we finally got the shot record in from the other place that they used to go, and then they were missing a shot. They need a shot. They've already had their wellness visit. All they need is the shot. They can schedule a shot only visit where they come in, the nurse sees them, and they get a shot and they're ready to go. Okay? And then we have our lab only visits. So lab only visits are going to be, I call, they say they can get me in tomorrow. My kid is running fever. I really think that they have strep throat because they've been exposed. Can I just come in and get them swabbed for strep throat, please? Yes. The nurse will see you and swab for strep throat. Or if you say, I think they have the flu, like they'll do the swabs and then they will let you go, whether it's positive, negative, they'll tell you the result and you'll be able to go based off of what the result of the lab says. Or a urine test, like my kid is complaining about pain when they urinate. Can I just come in and get the urine checked? That is a lab only visit. The doctor does not come in for that visit, okay? And so the reason I like to distinguish that is because a lot of times we have people that schedule a lab visit. They just want to come in and get them swabbed for strep throat. And then they say, well, I thought I was going to see Dr. Calloway. It's like, you called and asked for a lab visit. You said they've been exposed. You just want them to check and see if they have strep throat. There's no reason for the doctor to come in because you didn't want a visit. You wanted a lab visit. So that's where the difference is, okay? If you want a visit, they'll say, let's schedule you for the next available sick visit. Different from a lab only, different from just coming in real quick and getting swabbed, coming in real quick and getting the urine checked. That's different because the doctor will have to put you on her schedule so that she can have time to come in and talk with you about the sore throat. If the strep is negative, then we sit and we find out if something else is going on. Yes, make sense? Okay, so those are our visit types. People ask, well, what about like band physicals or football physicals? Those are your wellness visits, same thing. But if you've had one and you need paperwork signed and we need to just do a quick visit, then that is under your sick visits, an athletic physical. If a wellness visit has recently happened, you can just drop off the paperwork and we sign it. But your wellness visits, yearly checkups, have to be up to date for us to just sign it and let you go. Okay, so one more time. Wellness visits, your typical growth and development visits. Typical, normal, they are every 2 months when they're little, then they go to every 6 months, and then once a year. When they turn 3, they're at once a year, okay? Those are the visits that they get their shots. Those have to be kept because insurance wants you to keep them, and you want to make sure that your kid is well once a year, okay? Sick visits, anything that's not just a typical wellness visit. Weight checks, your lab only visits, and then, like I said, the athletic physicals, those can be included in your wellness visits so that we can sign paperwork. That should cover the visits that we have for this clinic and most pediatric clinics. One more thing, billing is different. Billing is different based off of what is covered, what you say you're coming for. So let me give you an example. If you come for a wellness visit, your wellness visits are covered by your insurance company. It's a free visit. Your wellness visit, no copay. It's just a free visit. Okay. And so, but if you come to your wellness visit and you say, my kid has had a headache for 2 weeks and we started running fever yesterday. I know we're here for our wellness visit, but can you go ahead and see if they have strep throat or if they have the flu? Can you check this out? So this is separate from me checking growth and development. So now we've veered into a sick visit, right? Because now we're talking about headaches for 2 weeks and fever. So now you've got a well visit and a sick visit at the same time. So most insurance companies will cover that. However, now you have a copay because this is not your wellness visit, which is free with your insurance company. Now we're talking about a sick visit. And I want to clarify that because we have frustrations because we don't understand, well, my visit was a wellness visit, but we started doing swabs because your kiddo had a fever. That was a sick visit. Now, there are some insurance companies that will not allow a well visit and a sick visit at the same time. If you know your insurance company is one of those, X-lay if you say, nope, I don't want to do the well visit today because we are sick. Then change it to a sick visit so it doesn't come out of your pocket. It makes more, it's better to just change it to a sick visit and wait on the next wellness appointment slot, okay? And so I like to say that so people can understand the difference. Your lab-only visits are charged differently because you didn't have to see the doctor. You only saw the nurse. So it's a difference in the cost when you have a lab-only or a nurse visit than when you have an actual visit. So if you come in and you want it to be swabbed and you say, I have questions for the doctor, and they go, well, okay, hold on, we'll have to see if she can get you in between patients because you weren't on her schedule. And they grab and we come in. Now we've completely changed the type of visit from a lab only to a sick visit, and it's billed differently. So I wanted to clarify the difference between these visits so that we are aware of what's happening when we get our billing statements and we go, wait a minute. Or when we all of a sudden have a copay that's due and we come in and they say you owe a $25 copay from the last visit, and you go, that was a wellness visit. But it looks like on here you guys talked about we have difficulty sleeping, you talked about a toothache, you talked about a rash, you changed it to a sick visit when you started adding in illnesses or differences versus just checking off growth and development and making sure we talk about what to prevent before the next year, what to watch for, things to talk about for that age group. These are the differences in appointment types. This is very important for you to know so you know what to call and ask for when you're making your appointment. And so again, I know this podcast wasn't your typical giving you information about certain things. This is for the parents, literally, not about their children, about their parents and the way we make the appointments, how we schedule it, how the billing works. This is just to clear some things up. So I hope it was important to you. I hope that you shared this information. Everybody needs to know, not just my practice. This is for all pediatric practices. There is a difference between a well visit, a sick visit, a lab only visit, a nurse visit. There are differences in billing and the way you schedule them. Okay, so I hope it was helpful. Thank you for joining me this week, and I will see you next Friday.